So for my 1099 work right now, I just do like freestanding surgery centers, plastic surgery, GI clinics, eye cases. Orthopedic surgery is a huge thing. Lots of orthopedic surgery being done outpatient, and they need lots of anesthesia providers. What else do we do? Podiatry. Of course, you'll do some general surgery stuff and pain procedures, lots of pain procedures and all of that. And so, yeah, I would say I do a lot of that as my 1099 work, but I still maintain a per diem position with my previous W-2 employer, which is a larger hospital system. And I go back there and I'll do a little bit of 1 or 2 days a month. I'll drop in there and help them out with staffing. And I will do like OB cases where you won't really be doing a lot of epidurals and OB type cases in a freestanding surgery center. So you might keep a job per diem somewhere where you can keep your skills doing a little bit more the OB, or maybe some pediatrics, or maybe some more complex types of cases in a bigger hospital.
That's actually a question I was going to ask. How does your anesthesia practice differ from the rural areas, less hospital-based, versus working in the city with a large provider?
Yeah, so I mean, actually the surgery centers that I work for are still in the urban areas right nearby, but they are just freestanding clinics. But the practices change because in a bigger hospital system, you're going to have an entire team of personnel. You're going to have physician anesthesiologists, you're going to have CRNAs, you're going to have a slew of anesthesia techs who help you out. There's lots of nurses and all over the place that you're meeting, and there's management and administration who are all making rules and regulations and all of these things. But in the smaller setting, like a surgery center, it's just each provider for themselves, essentially. There are no managers. There are no people, guiding you or telling you go here and do this now and, only do this type of protocol or things like that. You kind of make your own rules within safe practice, and everyone's expected to practice at the top of their license. So there are no physician anesthesiologists as a CRNA who oversees me or guides me. If I want to do a peripheral nerve block, I do that peripheral nerve block for my patient. It's very much a conversation with me and the surgeon based off of the case and what the surgeon's looking for and what I'm looking for and what the patient wants. And so you provide your own pre-op anesthetics, you prescribe your own pre-op meds, you intra-op manage your patient, you prescribe PACU drugs and management for your patient. If there's a problem in PACU, instead of calling, like in a larger hospital system, there'll be a specific person assigned to PACU from the anesthesia team who's like managing those patients. But in the freestanding surgery center world, they'll just call you if there's something wrong with your patient and say, can you come fix this, or what do you think? And so it's a lot more responsibility, but we're trained to do that as CRNAs, and I enjoy it.
If you want to watch or listen to our latest episode,
You can check us out on Apple, Spotify, or watch us on YouTube.